Why some Botox treatments fail. Most people assume that if botulinum toxin doesn't work, the solution is simple. Just use more units. But in aesthetic medicine, more toxin is not always better. In fact, some of the worst botulinum toxin results occur because too much product was used in the wrong patient or in the wrong muscle. What is botulinum toxin actually treating? Botulinum toxin treats muscle activity, dynamic wrinkles, facial movement patterns. It does not treat skin laxity, volume loss, deep static wrinkles, tissue descent, sun damage. This is the first reason treatments fail. Many patients are being treated for problems that toxin cannot fix. Dynamic lines appear with movement. Examples: forehead lines, glabellar lines, crow's feet. Static lines present at rest. These often involve skin changes, collagen loss, long-standing muscle activity. Toxin can soften static lines but rarely removes them completely. The assessment mistakes. Forehead lines. Many practitioners treat the forehead without considering brow position. Result: brow heaviness, hooding, tired appearance, crow's feet. Overtreatment can reduce smile dynamics. Patients may describe, "My smile feels strange." Masseter treatment. Reducing muscle bulk may worsen jowls in selected patients. Neck treatment. Treating platysma without considering lower face support can worsen aging changes. Assessment matters more than units. The myth of more units. Patients sometimes assume more units equals better results. This is rarely true. Excess dosing may produce heaviness, asymmetry, unnatural expression, functional problems, shorter patient satisfaction. The objective is not maximum paralysis. The objective is balanced muscle modulation. Anatomical variation. No two patients are identical. Factors include muscle size, muscle strength, asymmetry, sex, age, previous treatments. This is why standard dosing charts only provide a starting point. Individual assessment is essential. Why resistance is uncommon. One concern patients raise is, has my Botox stopped working? True immunological resistance appears to be uncommon in aesthetic practice. More common explanations include undertreatment, inappropriate muscle selection, unrealistic expectations, progression of aging, inadequate follow-up assessment. What does success look like? Successful toxin treatment should preserve natural expression, soften excessive movement, maintain facial balance, avoid heaviness, avoid obvious treatment signs. The best Botox treatment is often the one nobody notices. Take-home message. If a treatment fails, the answer is not always more toxin. Assessment, anatomy and treatment planning determine outcomes far more than the number of units injected. Understanding facial muscles requires more than memorizing injection points. It requires understanding anatomy, function and how facial muscles interact with one another. These are exactly the concepts explored in Anatomy for Injectors and the Cadaver Dissection Workshop for Injectors. Thanks for watching. Like, comment, subscribe, and share to support the channel.